State health leaders say the coronavirus risk is still low in Alabama. Though there are still no reports of the disease in Alabama, now that we're surrounded by states with confirmed cases, including Florida, Georgia, and Tennessee, it may not be long before we do see it here.
As this continues, if cases continue in other states, we do expect that we will have some cases in Alabama.
The state health department's Bureau of Clinical Laboratories is now testing for coronavirus on its own without needing to send samples to the CDC. Dr. Karen Landers says patients must meet specific criteria to be approved for testing.
If we had a person that traveled from a high-risk area and had certain criteria such as fever, cough, lower respiratory symptoms, again, this is all spelled out on our website, then we would consider those persons to be someone that we would need to test.
If a patient doesn't meet the criteria listed here, but physicians would still like their patients tested, they can also contact some commercial labs in the state that will also be doing coronavirus testing. Dr. Landers reminds Alabamians a lot can be done to protect ourselves.
Our preventive measures will help us to reduce the risk of spread of this virus.
She says people who have not traveled to places where there have been outbreaks or do not have respiratory symptoms don't need to be tested. Dr. Landers says the most important thing is to practice good hygiene, stay home when you're sick, and stay away from sick people. Live in downtown Mobile, Morella Porter, Fox 10 News.